Hi, I'm Dr. Paul Shrogin, here learning with Dr. Tim at the Diplomate of American Chiropractic Orthopedists. And we had a long conversation about carpal tunnel, and I know in my practice I see this a lot. I'm a diplomate in neurology, so I've got some little tricks of the trade that I use sometimes. So one of the things I want to talk about today is this incredible clinical pearl when it comes to people that walk into your office and say, I have carpal tunnel syndrome. So if you're looking at the hand and the wrist, I know I have patients that come in all the time that say, I have carpal tunnel syndrome, and I ask their symptoms and they say, well, I've got numbness here, and they kind of gesture to everything. And I say, okay, where specifically is your numbness? Now you guys probably know that carpal tunnel syndrome primarily affects the first 3 digits. But here's the clinical pearl with carpal tunnel syndrome. If the numbness moves past the digit and into the palm, it's no longer only impingement at the carpal tunnel. That's because there is a digital branch of the palmar interosseous nerve that travels through the carpal tunnel and innervates these 3 digits. There is also a palmar branch of the carpal tunnel that travels over the carpal tunnel and innervates the palm. So there's no way that that palmar branch is impinged inside of the carpal tunnel because it doesn't travel through the carpal tunnel. So if they have numbness in their palm, well, they may have carpal tunnel, and you need to differentiate that clinically. You also need to look up the stream for a double crush syndrome or something else, pronator teres, etc. So continuing that, since we know that approximately 3/4 of patients that have nocturnal numbness and pain in a median nerve distribution that wakes them up have carpal tunnel syndrome, we need to look at what that other 25% consists of. The second most common most common condition that patients have is pronator teres syndrome. That median nerve up the stream can get impinged in the pronator teres in a similar manner to other muscular impingements, and there's a whole lot of tests you can look at for that. But the very simple nerve test of push on it and does it make it worse is pretty go-to for all of these things. I hope this helps you in your clinical practice. Thank you for watching, and if you have any questions, feel free to contact Dr. Tim and his team.